Hello everyone, my name is Lauren Diaz Boyle and I am an internal medicine resident at the University of Texas Health Science Center in San Antonio, Texas. My co-authors are Dr. Daniel Rosas and Dr. Kate Lathrop, and today we present a case of epithelioid hemangioendothelioma in a young male, a 1 in a million diagnosis. Epithelioid hemangioendothelioma, or EHE, is an extremely rare vascular tumor. It is described as somewhere in between a hemangioma and an angiosarcoma. Its incidence is measured to be around 1 per million people. Because it is vascular in origin, it can arise anywhere in the body but has been most reported in the liver and lungs. EHE is indolent in nature, but if determined histologically to be atypical, such as having a high mitotic index, it can be more aggressive. Our case is a 27-year-old male previously incarcerated for the past several years with no significant medical history who presented with right-sided back pain that radiated to his inguinal area and a 50-pound weight loss over the past year. On admission, he was febrile and tachycardic. Right inguinal lymphadenopathy was noted on physical examination. He was found to have sepsis in the setting of dysuria and was admitted for IV antibiotic treatment. Given his abnormally persistent pain and possible UTI, further imaging was done and revealed a retroperitoneal cystic-like mass associated with right-sided para-aortic and iliac chain lymphadenopathy, which was causing hydroureter-nephrosis and occlusion of the infrarenal IVC, right common internal and external iliac veins. The retroperitoneal mass was excised and found to be a benign lymphocele, and the patient underwent multiple stent placements with vascular surgery. CT-guided biopsy of the inguinal lymphadenopathy demonstrated atypical findings which required special stains. Subsequent immunohistochemical studies from Mayo Clinic were positive for vascular markers including CD31, ERG, and FLI1, as well as CD56 and CAMTA1, a tumor-specific marker for EHE, and FISH identification of the WWTR1 and CAMTA1 fusion protein, and the diagnosis of stage 3B epithelioid hemangioendothelioma was made. In the center of the poster, you can see CT scans which highlight the para-aortic lymph node, seen here, as well as the inguinal lymph node in the bottom picture, seen here. This bottom lymph node was the lymph node that was biopsied and demonstrated EHE. Discussion. This rare disease, coupled with the patient's nonspecific presenting symptoms, his chronic back pain, made diagnosis difficult. Special stains are needed in diagnosing EHE, and genetic testing can be done to help distinguish between other vascular tumors, with FISH detection of the WWTR1 and CAMTA1 fusion protein being the most sensitive and specific to EHE. Currently, there are no targets to this fusion protein. Treatment options, including chemotherapy, surgery, and radiotherapy, have been reported, although the literature is scarce. Treatment of other vascular tumors have shown that there is evidence to support the use of chemotherapy and immunotherapy targeting angiogenesis. Our patient was discussed at Sarcoma Tumor Board at our hospital and was started on carboplatin, paclitaxel, and Avastin. Ultimately, more research is needed to help shape a framework for structured regimens for patients with epithelioid hemangioendothelioma. Thank you so much in your time listening to my presentation.